Claudia graduated from the Honors Life Science Co-op program at McMaster University in 2018. For her first co-op placement, she had the opportunity to work as a research assistant at the GERAS Centre, where she conducted home visits and data collection for the TRIAGE project. Claudia then did her second co-op placement at the Aging Community and Health Research Unit as a student researcher. Claudia is now in her first year in the Masters of Science in Occupational Therapy program at the University of Toronto, working towards a career in geriatrics.
So again, my name is Claudia, and I'll be speaking about the role of occupational therapy, just very briefly, because occupational therapy is quite broad, and we only have 15 to 20 minutes, so we'll see how it goes. So just an outline here, we're going to be talking about what is occupational therapy, or OT, the Ontario OT program admission requirements, fieldwork placements, becoming an OT, and areas and populations that OTs work with. So first off, show of hands, who here has heard of occupational therapy before? Great, okay. Can someone tell me what occupational therapy is? You can shout it out if you want. Okay, good, because we're going to talk about it, so that's great. Okay, so what is OT exactly? So based on the Canadian Association of Occupational Therapists definition, it is a type of healthcare that helps to solve the problems that interfere with the person's ability to do the things that are important to them. So basically, those who seek out occupational therapy are clients who have barriers doing the meaningful activities that are important to them in their day-to-day life. So what occupational therapy does is it helps the clients learn new ways of doing things, so things that are important to them, helps them regain skills that they've lost and actually help develop new skills. And it helps use materials or equipment that makes life easier. So say if somebody had difficulty with eating, they would have maybe adaptive equipment to help with that. Also, it adapts their environment. So it helps them, if they're having difficulty in their home, it helps to kind of adapt their environment to help them engage in their activities. So occupation is the center of occupational therapy. So occupation is defined as an activity or task that occupies your time. So occupations bring meaning and purpose to somebody's life. And occupations can be divided into what you need to do, what you're expected to do, and what you want to do. So essentially, it can be divided into three specific domains. So self-care, productivity, and leisure. So self-care is essentially anything that you do for yourself, and it's kind of within the vicinity of your own body. So here are some examples. So eating, getting dressed, grooming, and toileting. So can anyone, based off these, can think of anything else that is a self-care activity or occupation? Can you yell it out? Yep. Great, perfect. So exercising is what they said. Great. So the next is productivity. And productivity is kind of what you think as your typical job, getting your degree, going to work. So it's anything that you're contributing and allowing for you to partake in your community. And it's things that you kind of feel like you need to do. You can want to do them, but it's kind of what you're expected to do as well. So examples, of course, would be school, work, and even household chores. And next we have leisure. So leisure is basically anything that you want to do and you kind of do on your own spare time and things that you genuinely love doing. So some examples here, social activities, so hanging out with friends, sports, playing soccer, or even gardening. So show of hands here, who would say that sleeping is a leisure activity for them? Exactly, yeah. So sleep is a good example because a lot of people say, kind of joke around saying, oh, like sleep is my hobby, I love sleeping. But there are certain occupations that can be in many domains. So sleeping, for example, can be under self-care because you need to sleep every night to kind of function well. And also sleeping can be a hobby of ours because we enjoy doing it and it's great. So it's kind of important just to realize that certain occupations can fall into all three domains, so self-care, productivity, leisure, and it's kind of dependent on just how the specific person identifies that occupation. So when we're trying to understand occupation and being able to mediate different barriers, we want to look at the PEO model, which is just one model of occupational therapy. So the PEO model looks at the person, occupation, and environment. So the person would be the individual that you're working with. The occupation would be, again, the activity that they want to do. So for example, gardening. And the environment can be both their physical environment, so school would be an environment, the home, or even their social environment, so their friends and families that they surround themselves with. So essentially, we want to have a good fit between the person, occupation, and environment in order to occupationally perform well. And to occupationally perform well, it just means that you're able to kind of have a good fit between the three, and have good performance in your activity. So because of all the models, PEO model for one example, OT is very client-centered. So you really get to know your client very well, especially during initial assessments. So when you have an initial assessment with a client, you're really getting to know them, their goals, what's important to them. So some initial assessments can be 5 minutes, just a quick chat. Others can be upwards to an hour. And it's really trying to understand why are they here, what is important to them. It's not just what we think. Also, OT is very client-centered because you can also have the family members as your clients as well. So an example for this could be caregivers. So if we're at acute care and someone's going to be discharged, and somebody has a caregiver, we honestly want to make sure that the caregiver also has resources that can help support the client at home. So we really want to look at all pieces of the puzzle and ensure that all factors are considered when we're helping the client. Okay, so this question comes up a lot. What is the difference between OT and PT? A lot of people get that mixed up. Does anybody know what the difference is between occupational therapy and physiotherapy? No? That's okay. So OT is looking at function. So we want to help the person be able to do the activities that are meaningful to them. So we're enabling them in their occupation. As opposed to physiotherapy, which looks more at the structure and strength, so strengthening muscles and helping with movement. So they're looking at the physical components of the body, as opposed to OT, where we also look at the physical, but we might look at all of the social, psychosocial factors and all the factors that contribute to them not being able to work on their occupation. So although they have two very different functions and abilities, they also work very closely together, and you will see OTs and PTs working closely together in a lot of settings. So just an interesting read here in an article. In 2017, an author looked at the hospital spending on certain services and their rates on readmission. So it actually showed that higher hospital spending on occupational therapy is associated with low readmission rates, or lower readmission rates. So without even reading this, can anyone tell me why do you think this could be? You can just shout out anything. Okay. So basically, occupational therapists really focus on trying to help the person manage. So they would do disability management, symptom management, and really help them have different coping strategies or management strategies at home or in their environment, and it helps them not go back into the hospital. Okay, so now that we talked about occupational therapy, if you wanted to be an occupational therapist, you have to, of course, go through the 2-year program. So in Ontario, there are 5 Ontario programs that are accredited. And essentially, accreditation means by the Canadian Association of Occupational Therapists, or CAOT. And essentially, being accredited just means that you're able to write the licensing exam after and then register with the college. So the program itself is 24 months full-time. And after you receive an MSCOT, which is Masters of Science in OT. The admission process is highly competitive. So all schools look at grades. But some schools, their other requirements may be interviews, reference letters, or essay questions. And to be eligible for the program, you're required to have a 4-year bachelor's program. And typically, every person kind of varies in what their program is, as long as you kind of meet the course requirements for the program. And the application is done through ORPAS, which is the Rehab Sciences Professional Master's Program application. So once you're in the program, about half of the program is actually field work, which is great. So you need 1,000 supervised fieldwork hours. And essentially, it's great that you're able to go into lecture, learn all the content, and then go and apply it to different settings. So here are just some examples of some settings that you would have. So acute care, rehab clinics, schools, and long-term care. And essentially, your responsibilities tend to increase with every placement that you have. And so some responsibilities that you might have in acute care, per se, is you may complete initial interviews, you might do cognitive assessments with clients, you can test their balance, their range of motion, you can assist with upcoming treatment plans. So an example of a treatment plan would be like education, rehab, things like that. And also discharge planning is quite large or quite huge in acute care, so you can help out with that. So now that you've finished your program and you actually want to become an occupational therapist, you need to write the licensing exam after graduation. So it's called the National Occupational Therapy Certification Exam. And after that, you're then able to register with the College of Occupational Therapists of Ontario in order to practice in Canada. And after registering, the reason why you register with the college is because occupational therapy is a regulated health profession. Okay, so OTs work in a variety of different settings, which is great. So it kind of appeals to different interests. So here are just some places that OTs can work in. So you can work in hospitals, rehab clinics, schools, long-term care, mental health centers, just to name a few. And a lot of people don't know that OTs can work in schools, and student mental health is so prevalent these days. And also, occupational therapists can work in schools with children who may have developmental delays or coordination issues, so they can teach them how to write, etc. Also, there's a lot of home care that is occurring, and occupational therapists can also work in insurance companies, say somebody had a motor vehicle accident, trying to help them after that. And OTs can also work in government and advocacy to help fight for all the voices in legislation and laws. So here are just some of the populations that OTs work with. So we really want to emphasize that OTs can work with any age across the whole lifespan. So you can work with a baby trying to teach them how to help them feed, to an older adult for fall prevention. Also, it's very important to note that they're very pivotal in transitional moments. A child with somebody on the spectrum, autism spectrum disorder, transitioning from school to getting their first job can be difficult. Also for individuals who have worked their whole life and then going into retirement. So OT is very crucial in those moments. So some other populations are developmental delays, brain injury, neurological disorders, stroke, individuals with physical impairments, so like paralysis, even oncology. A lot of people don't know that as well. OTs can help a lot with energy conservation, just so helping them with techniques to kind of preserve their energies through the day. And also mental illness, which can range from dementia to depression, schizophrenia, etc. So here are just some roles of OTs in healthcare teams or settings. So OTs really do a lot of home assessments. So they'll go into the home, look at the environment, see if it's safe, help, say somebody needs like a grab bar in the shower. They're really kind of trying to look for and to ensure that everybody can kind of thrive in their environments. Seating and mobility is very huge, especially in long-term care. A lot of individuals who are sitting in wheelchairs, they may not be sitting properly, and you want to prevent ulcers and like misalignment and everything. Physical rehab, physical and cognitive assessments, so range of motion, cognitive assessment, example is the MOCA, you can look that up. And OTs actually are able to do psychotherapy if they're trained. So that includes motivational coaching and even cognitive behavioral therapy, just to name a few. OTs also do discharge planning, which ties in with sometimes with case managers. So when you want to discharge an individual from the hospital, you really want to ensure that they have the proper supports and resources in their environment to make sure that they're safe and getting the support that they need. Also management and coping strategies, so educating the client and both their families, and also even hand therapy. So you're not able to be an actual licensed OT in hand therapy, but you're able to have the certifications. You just can't call yourself a hand therapist, but you're able to work in hand therapy clinics if you're certified. So as you can see, there's a lot here, and this is just a few of them. So just some general areas of interest that OTs like to work in. So Indigenous health, especially up north if healthcare teams aren't that large. Autism spectrum disorder, student mental health, which is quite large these days, fall prevention, older driver safety, substance use with the opioid crisis and everything, social inclusion, so ensuring that everybody's voices are heard from all groups, workplace physical health and well-being and their mental health, stroke and spinal cord injuries. So again, just a few of all. And that is all I have. Thank you very much, and I'll be taking questions.